Welcome to our third colloquium. Today we have Dr. Dominique Brossard speaking from the US. I'm sure everyone here already know who she is, but I will give an introduction. She is a professor and chair in the Department of Life Science Communication in the University of Wisconsin-Madison, and is affiliated with also many other institutes at the university. She's an ICA fellow, among other honors, and directs the advisory board of the US National Science Foundation. Her teaching responsibility lies mainly in the strategic communications theory and research, with a focus on science and risk communication. Her research agenda focuses on the junction between science, media, and policy. And she is especially interested in understanding the roles of values in shaping public attitudes and using cross-cultural analysis to understanding this process. She has a Master's of Science in Plant Biotechnology from the School of Agriculture and Life Science in Toulouse, and her Master's of Professional Studies and PhD in Communication from Cornell University. She also has a diverse background. She worked in labs and in the corporate world. With this, I'll give her the word to discuss her paper, Science Communication During COVID-19, When Theory Meets Practice and Best Practices Meet Reality. Welcome.
Thank you, Paulina, and it's really a pleasure to be here with, the participants are the one we see, right? So this is a small group, so maybe we could do a discussion more than anything else. I have a few slides I can share. But just to give, some context to what I was going to talk about, as Paulina was saying, I was asked to discuss this paper, Science Communication During COVID-19, When Theory Meets Practice and Best Practice Meets Reality. And so this is a little different talk to some extent, because if you focus really on a specific paper. I don't think I need to introduce COVID-19 to anybody in the group, and so we all know the context, but just imagine yourself in a lot of the same shoes that all of you in the room are. We're there, we're eager to help that this pandemic starts. And so we all knew that in March, at least here, in the United States, I think timing varies a little bit across the world, but there was a need for communication and persuasion, and we needed people to do a certain thing. But the strategy and structure for developing and deploying effective messaging was not really clear, at least to different actors. A lot of people, were involved in this. And at that time, actually, we were lucky to have at UW-Madison, we have something that's called University Alliance, and it's actually a structure within the structure that is focusing on trying to partner civic partners with academic partners. And, like classes uses those. For example, one of my class helped develop, a campaign with the community in Wisconsin to be more sustainable and so on. So these people actually called me and they said, this is really seems like communication is needed. The League of Wisconsin Municipality, which is actually a big association of all the cities, most of them in rural area, had approached that University Alliance, said, we need help, we're not equipped, we do not really know how to go with this, and the Department of Health Services at the central stage is not really doing much, taking into account our context and so on. So one thing leading to the other, we created very quickly that UW-Madison Communication Collaborative for COVID-19 coronary response, with a bunch of partners. So we had, I say like 30 different institutions that were represented. When I say institution, is also public health or mayors and so on. But, I at least had 150 people, and at our meetings that were taking place twice a week, we always had at least 80 people that were around. And the idea was really to try to help on the ground people that needed to do communication around COVID-19. And so this paper is really what we call the practice inside. This is, by the way, I'm on the board of the Journal of Science Communication. Bruce, we miss you. Yeah, I know that you had to turn to other things. But one decision that was made for this journal a while back was to not have only research, papers, but also what we call practice insights. Like, can we actually step back from the research and actually give some insight that would be useful to practitioners? And it's been well received so far, but so really to establish a dialogue and see how, you know, these different communities can learn from each other. And so as you see, a lot of authors, I mean, there's academics from the, you know, the Department of Psychology, the Department of Sociology and so on, but also people from the League of City, Public Health, and so on. And here you can see that after the two first names, then is by alphabetical order. I was actually the PI for the thing, but the two first ones are students that we hired to work with us based with our own funding. So, okay, so insights, you know, like very quickly, as you all know, I mean, Wisconsin, a state of the Midwest that almost at the border with Canada. It's a state, I'm going to talk a little bit later on. It's a little, like, as you know, like United States is a federation of states. I always tell my colleagues in Europe that they tend to think of United States like a country, but it's really a federation of states. States have a lot of power. There's a lot of delegation to the states for matters, you know, public health, education, police, marriage, and so on. That's why we always fight in between the federals and the local level. But the state is really, like, you know, in charge of a lot of things and quite independently, frankly, obviously within the laws of the federal state. So for COVID-19, every state developed their own guidelines, their own, you know, within the framework of the federation. So the state. So what we arrived, we wanted to help. A lot was not known of what was happening in March 2020, but a lot was known as far as how to help in the context of crisis and pandemics and so on. So, you know, like we very soon we were telling our colleagues, the practitioners, that we could draw and establish social science findings, not only in the science of science communication, obviously, but also a lot in risk communication and crisis communication that has been, you know, like actually well-established disciplines with a lot of insights on psychology of risk and so on. And also, by the way, social marketing and other approaches. We had on our team different people that were managing the social media accounts of all those organizations with, you know, like thousands, hundreds of thousands of followers and so on. So obviously social marketing techniques and so on. So we knew a lot from the, let's say, theoretical perspective, but we didn't know much. I mean, we knew the local context, obviously, but as you all know, all the others are different when we think about different issues. So here's Wisconsin. I mean, the little heart is where Madison is. You can see, can you see the arrow when I move it or not? Yeah. So like what's interesting about Wisconsin. So first of all, you see we are bordered with Canada. We have the Great Lakes. Beautiful, by the way. Those of you who do not know, you're welcome anytime. Come visit. Winter, summer, we have everything. But what's interesting about this state, you have big metropolitan areas, right? Green Bay, Milwaukee, Madison, Chicago is not far. But then when you go you go up north here, it's really actually super wild. Tons of lakes, that the national forest. It's really, like, say, we call it the North Woods, and we have 12 tribes, you know, like that have the Menominee Reservation and so on. Compared to other parts of the United States, by the way, our tribes stayed where they are from here around Eagle, you know, like you all heard about the Trail of Tears and so on, you know, the Cherokee being moved. Like here, like, you know, we have actually very established reservation that are key partners in a lot of projects. So here you go. The thing is that, so like all Wisconsin, you know, north of here, it's super rural. So we are a purple state. So sometimes, you know, people vote blue Democrats, sometimes they vote red Republican, they switch back and forth. And all the rural houses are really conservative. And I'm saying that because it's super important in the context of communication about COVID. When we started thinking about working, you know, on this project, we really quickly realized that you cannot do anything if you don't have infrastructure. So that practice insight, one thing that we were saying is like, pandemic will start again, and hopefully we can contain them. They have happened in the past and they've been contained more, at least in the United States. I'm thinking about H1N1 and others, Ebola and so on. But what we quickly saw is that those networks, those structures linking practitioners and theoreticians and data science and so on were not established. And we lost very valuable time actually establishing even, networking and having a clear line of communication with the Department of Public Health. Took us almost, a month to make sure that this was established. Infrastructure, and I do believe that, institution of higher education, such as mine and yours, have a critical role to play, that we cannot just sit and wait for people to call us. I do actually, my big firm belief, and I know Bruce is, he was my advisor for something, he shares my view that we need to be, involved on the local level for evaluations, for different programs, for public engagement and so on. And this takes time, and anything we can do that will, in the future save time is something that would be very valuable. Another thing that we realize is infrastructures as far as involving students. We quickly learned that the hard to reach were the 18 to 25 actually, and we had 40,000 of them, working at UW, and they were so eager to help. And we quickly created structures for them to be involved in our project and being able to take for credit, they have academic credit by doing so. So by the way, this thing that I'm telling you is that we had a lot of mistakes, we lost a lot of time, and it's not that we're perfect and I'm trying to say, yeah, we were so great. We were not. We actually have, struggled to actually put into place a system that would work. And we realized that, a lot of that coordination between team members and so on, if somebody doesn't step up and does the work, nothing is happening, as we all know. And so that was really like something to clearly, right away from the start, define a structure, include the students, and make sure that we could work very closely with public health officials in order to not reinvent the wheel when we were on the ground. Another thing that was clear is like everybody wanted to do everything everywhere. And I don't know if it was the same in your countries and in your state, Bruce, but there was, attempts by everyone. And that's different, by the way. We went through other pandemics. But I think from a social science perspective, I mean, it was the first time, and Bruce, I'm curious to see if it was the same in New York State, where we had such an involvement in academics in the practical matters. Like in other projects, it was more like one individual or not, but not full departments that were asked to participate from the public health departments. Usually they approach the School of Medicine. Well, they approach me because it's my risk communication, right? But that eagerness to have those linkages was extremely important. So it was, like daunting that they were, kind of expecting us to have the magic bullet, right? We're going to do something, everybody's going to follow our recommendations because, we're going to do social science research and solve everything. So very, very early on, we developed a clear goal and key activities. And so our goal was, we will have, sound social science research that's going to find out belief attitudes, motivators, and barriers among Wisconsin population to adopt protective behavior, and more precisely, social distancing. Because right away from the start, people were against, social distance. So it was, really had been clear. And so as we were doing our research, we didn't have yet data to know what would, prevent people from engaging. So we did the little, simple things like that were translated in different languages, Spanish, Hmong, and so on, to actually distribute around the state. While we were doing it, we started to gather data, and we were helped by the UW communication news thing. So we were trying at the same time to find money to actually do a sound, probability sample and so on in Wisconsin. But at the same time, this takes time to find money. This is another thing in the infrastructure. We need to have money for emergencies, emergency research needs money. So we did like a convenience sample where we took people, we did that thing, and it went viral. We actually had 49,000 people that answered that survey. So that was actually interesting because we had a lot of open-ended questions, and where we did big data analysis of the comments, and there's papers, research papers that came out. A young colleague, Kai-Pin Chen, that has computational communication, delved into the open comments and so on to try to have data that would allow us to identify the beliefs and attitudes of people. And what we realized very soon is, number one, people thought like that the people that didn't want to do the social distances was those 18 to 25. They did trust the CDC at that time. It wasn't political yet. Actually in Wisconsin, that very polarized state, COVID-19 was not a politicized issue. People were just, wondering what was going on, what they could do, and so on. And the main issue was that it was fine and dandy that social distance, but it was not practical at work and so on. And that if you were 18 to 25-year-old man, putting a mask or social distance looked like you were not a real man. I'm just paraphrasing the beliefs that we found. So, we did a report also about some of that data that we posted that was sent around with summaries that were put in all the newsletters of the municipality around Wisconsin and so on. So going to the thing, but so going back to the approach that we were really trying to do in April is we need to use an adequate theoretical framework that's relevant to the context, goals, effective development of persuasive message. And obviously we know a lot about, right, that persuasion, using social norms, putting email, all that stuff that I'm not going to teach you here. Obviously you all know. So here is what we came up, like being tested with a lot of our young undergrads and so on, with to reach those white 18 to 25 males that didn't want to wear masks. And, all our interviews showed that they're like, I don't want to appear weak. I don't want to be scared. So wearing a mask does not make me weak, scared, dumb, or controlled. It makes me considerate. You have to replace this at in the Midwest. It's super important to be nice. It's super important to be considerate. It's actually a value that people really, really like. If you tell someone you're not considerate, they'll be like, whoa, that's kind of an insult here. So we tested it worked really well. I mean, this one we have 2,000 likes for that. A lot of people commenting, sharing, and so on. So just to give you an example of one of the type of persuasion we did. And then we use moral foundation theory for that really weird looking thing here. Moral foundation theory, you must know, what it is like, appealing to different moral values, honesty, and so on, etc. And one of them, this was interesting because we were trying to find use Instagram, and I'm trying to find the details about that, Instagram, because those 18 to 25 years old were on Instagram, right? And the idea was, that there is those different values. One is care, harm, fairness, cheating, loyalty, betrayal, authority, subversion, and sanctity, degradation, and so on. The sixth moral foundation theory of oppression has been proposed later, but we didn't build on this one. So we came up with this scene. It's like, like we're talking about young people that the belief that seemed to be working, or the approach that seemed to be working with those in our pretest and so on, is like you need to actually rely on patriotism, and it's your duty to be a fighter, like like the cavalry kind of thing that we try to portray here, working with a graphic thing. So very well received in pretest and so on. Unfortunately, it was a flop on Instagram. We bought media, right? We actually tried to, all our campaigns are media buys, but it didn't go viral. The people didn't follow and so on. And, we don't know why. I mean, why didn't it take up? Maybe like that the graphic is crappy, although it was really well received in pretest and so on. But so that was specifically designed for Instagram to reach those 18 to 25-year-old. So I think I'm gonna, and soon I had the, tape for like 20 minutes, so we could have a lot of time for discussion. But so like, this is really not, like surprising that what we found out is what textbooks tell us about what you need in terms of crisis is really what we need in terms of crisis. And honestly, we have that crisis communication structure and management plan now. And that, so if this was to happen again, we would go for it. We wish, retrospectively that we had clear goals and key activities right away, because we lost valuable time, doing so. We're actually pleased with the results of the social distancing campaigns and the masking one. Unfortunately, although we were able to collect data as soon as possible, leverage all sources, we would have needed to do it again and again. That's the problem. Things evolve so fast. Risk perceptions and belief structures evolve as media coverage is evolving, as the actors come into play and so on. And at that time, then, let's say in June, I actually step out of the whole thing. It's unfortunate, but so they didn't collect more data or anything. So this is the trick, is that you need to have the researchers that go to there and find the money and continue the research. I became involved with Sean, the Societal Expert Action Network, which is basically, like summarizing theory for policymakers on the ground to help, also for COVID-19. And then, like that task force in Wisconsin began using this practical advice as well. All right, so this is what I have. I don't know if is that what you were hoping or not. It's a very, very practice-oriented paper reflecting on our experience and how we can, in the future, be more effective with this kind of practical communication advice.